Okay, so now we're going to wrap up week 5 with some review here. Going back to our case with Cinderella. Let's see if we can fix this. So let's kind of break it down. Think about the big problem, clinical reasoning system that we're using. So what are the functional problems? She has 3 of them: scrubbing floors, carrying buckets of water, hammering. Those 3 are your problems. You could carry those all the way across and just have 3 goals at the end. What are your measures? What's your baseline measure? The pain, 5 out of 10, 4 out of 10, 3 out of 10. What do you think is causing her pain? What is your best guess? This one is a little bit tricky. It could be tennis elbow or it could be RTS. You probably don't really have enough information here. I would say let's go with tennis elbow. I'll say why I think it's tennis elbow. Tennis elbow because she is positive for Cosen's and middle finger test, plus she's positive with palpation on the lateral epicondyle. That's what I'm looking for. You're going to give me evidence that makes sense, that really supports your argument. She also reports weakness, loss of range of motion, pain with wrist extension. Also supports the idea that it's tennis elbow. Even hurts to lift a cup of coffee. Oh, sorry, I screwed that up. So she has a cup of coffee is her 4th functional problem. You need to carry that over for a goal. 2 out of 10. Gradually, here's her prior level of function. It started 6 months ago. One of her goals, you could say, to make a dress. You don't know what her pain levels for a dress. You can't really do that one. What is wrong with her elbow? Tennis elbow. How do we treat it? Some basic ideas of treating it. Go to the treatment box. You really need to know these treatment boxes inside and out. You need to know them all. Whether they're gray ones, really know them well for that midterm. It's a lot of material for sure, but start tackling that for that midterm and start clumping information together because a lot of it is similar across the shoulders and across these elbows. How to treat it, Mulligan glides, eccentric contraction, wrist cock-up splint, icing on the condyle, cross-friction massage, those sorts of things. Here's your student-led demonstration. You're adding the anatomy of the elbows. We get scapula, shoulder, and elbow anatomy along with the full screening. Learning objectives. How do you test for tennis elbow, Cosen's middle finger, with palpation of the lateral epicondyle? How do you test for golfer's elbow, resisted wrist flexion, or a golfer's elbow test with palpation of the medial epicondyle? RTS, you do middle finger or Cosen's with palpation of the extensor muscle belly. That's where the pain should be. Hemiplegic shoulder subluxation, how can you assess and determine that? Do the sulcus sign, that inferior glide we talked about. Just one way of treating tennis elbow, Mulligan's glide's probably the most effective thing. How do you treat golfer's elbow? I would try some icing, massaging the medial epicondyle, cross-friction maybe. How do you treat RTS syndrome? Since it is a nerve thing, you could try some radial nerve glides. What is the difference between radial tunnel and tennis elbow? RTS is more a nerve thing. Tennis elbow is more a tendon thing. But really, they present, it's just where the pain is located. RTS more in the extensor muscle belly. Tennis elbow more up on the lateral epicondyle. How do you treat shoulder subluxation? A lot of different ways. But we talked in specific about closed chain exercises. So the hand, the distal part of that chain, is fixed as you're flexing and extending it or doing activities with the affected arm and weight shifting, weight bearing onto it. Okay, then what's coming up? Note quiz, week 5. Could be called for the student-led demonstration. Whoop, should have the elbow there, that's a mistake. In the video cases are coming right up, so keep cranking on those. Let me know if you have questions. We're going to do 10-6.